The first presenter is Sonya Marshall-Gradiznik. She is an Australian researcher, professor at Griffith University in Queensland. Her theory, and again supported by a lot of research over the years, is about something called TRIPS, transient receptor potential ion channels. So TRIP ion channels. Ion channels are the portals in and out of our cells that allow charged molecules to move from one side of the membrane to the other. Think of them as the windows and doors, and these windows and doors are typically locked and require a key to allow them to open and function. Now, TRIPS convert the stressors that our cells detect from our environment, anything that challenges homeostasis, so think hormesis, changes in temperature or the concentration of certain molecules, and they change these signals into a biological signal which can allow the cell to take action to defend itself and to communicate the situation to its neighboring cells. Now, TRIPS are often involved in sensing pain, temperature, mechanical stress. They assist with things like the relaxation of blood vessels, neurotransmitter release and function, neuropeptide release, mitochondrial function, immune function. They're on every single cell in the body, and they're a very core part of how our bodies work. There are many dozens of types of TRIP ion channels. There's one in particular that Dr. Marshall-Gradiznik's team has been really learning about, and it's called the TRPM3. That stands for melastatin 3. It's a channel that allows calcium to flow into cells and into mitochondria. They study this channel using a gold standard methodology called a patch clamp. It allows them to very precisely measure the amount of calcium that's moving in and out of cells. They draw blood, they isolate the natural killer cells in a petri dish, and then they give the cells drugs that open the channels and drugs that close the channels, and they measure how the cells are affected by these drugs. In cells from patients with myalgic encephalomyelitis and long COVID, the TRPM3 ion channels do not work the way they're supposed to work. And this dysfunction is not subtle. It's very, very significant level of dysfunction. So what made this panel on pathophysiology really interesting is that not only did the researchers present, that we'll call it the bench research, like cells in petri dishes, but they're taking it a step further, trying to translate that research into things that could help patients. So one of the things that Dr. Marshall-Gradiznik's team noted is that mu opioid receptors, so the receptors that, say, morphine, oxycodone, and fentanyl bind to, inhibit this TRPM3. They thought to themselves, what would happen if we found an inhibitor for the inhibitor? Would that allow these channels to resume their normal function? So what is an inhibitor of the mu? It's something like naltrexone or naloxone. So naltrexone is the active ingredient in LDN, a very popular treatment that is being actively researched now by many groups around the world. The Australian group found that when they added naltrexone to these natural killer cells of people with ME, the TRPM3 function normalized. That's very exciting. They also found in a very small group of people that were on LDN by chance for clinical purposes, that their TRPM3 function was relatively normal. Now, as I mentioned, the TRPM3 ion channels are found all over the body, including the brain. And there are even TRPM3 channels in the mitochondrial membrane. And without this ability to move calcium around, the mitochondria are not able to make energy. So this problem with the TRPM3 ion channels could be at the root of many of the symptoms of ME/CFS. They're in every cell and every tissue in the body. And it may be one of the reasons why some people at least, are finding relief with LDN.